Hi everyone. Okay, so today we're going to be talking about the things I wish I knew before residency. So if this is your first time watching any of my videos, welcome. My channel is for anyone who's thinking about or currently training in medicine. I give advice based on my own life experiences. If this sounds like something you're interested, be sure to subscribe to my channel now. All right, so what do I wish I knew before starting residency? So first of all, working is hard. And this is coming from someone who worked a full-time job as well as a part-time job in one of her years off. So I was working like pretty much all the time, and still residency is so much harder. And it's really much harder because you're studying as well as working longer shifts than the average person does. And there's really no space for saying, oh, I just don't want to go in today, like how you were able to do in like med school. If you probably were just like, I don't feel like going to class, a lot of the times it was okay. That's not really an opportunity here. There's so much you have to do in residency. It's really challenging, and it's really great to have a great support system because I really don't think there's anything like it. Like I said, I've worked hard before, but this is really working hard. The next thing I wish I knew about starting residency is that you really have to take an extra step to focus on your bedside manners. And when I say that, I mean, like in medical school, they do stress bedside manners, but it's so much easier to do when you don't really have that many other responsibilities to take care of as a med student. However, in residency, there's so many other things you have to take care of. A lot of us will have to be preparing for rounds, seeing patients before rounds, putting orders in, writing notes, thinking through a diagnosis, and thinking of a treatment plan, coordinating with other interprofessional teams. You'll be doing all that. So when you go in to speak with a patient, a lot of the times your mind is so many other places that you really have to make sure that you're paying attention to the patient, because once again, you're there to take care of people, and really make sure you're introducing yourself, taking the time out to listen to them, and prioritize how they're feeling and how you can best treat them. Because with your mind in so many places, it's very easy to put bedside manners at the back burner because you'll feel like you're being pulled in a million different places. Even in the derm clinic, seeing patients back to back, a lot of times you start running behind and you often feel like, oh my God, I just need to see this patient and get out of here. But that will really affect patient care. So learning how to effectively manage a busy schedule while giving great bedside manners is going to be a great skill that you definitely have to continuously work on as a resident. I wish I had thought about how I would be handling just taking care of myself. I feel like you're working all the time. When you have off, you really don't want to be making like doctor's appointments and stuff like that. I was supposed to get my wisdom teeth pulled out like years ago and just never did it. Then I finally actually had it set up, like appointments scheduled for removal while in fourth year, and then I freaked out, got scared, and just canceled it. And I was like, I'll do it later. And then I started my intern year, and my wisdom teeth actually became symptomatic. And then I had to get it out, and it was super uncomfortable until I got it out. And then there was the healing process. So I would suggest, if you have any procedures or any surgeries coming that you know you need to get done, like get it done in your pre-med years and your med school years, that you're able to get the days off, because it's much harder in residency, especially if you have to take time off that you weren't expecting. People will have to cover your shift. You don't really want to inconvenience your co-residents when you don't have to, right? So think ahead about what you need to do for your health, and try to get stuff that needs to be done prior to your residency years. I've talked to residents, and a lot of them say, I haven't seen a doctor since I even started residency. I do think that we should figure out how to prioritize that a little bit more, that just advocating for yourself of when you need that time off. One thing I wish I knew when I started residency, that I would feel even dumber than I felt in med school. When I started as an intern, all of the med students seemed so much smarter than me, and I'm like, oh my God, like what is going on? Start residency after a break in medical school in your fourth year, and you realize that you don't remember anything. You've forgotten most of the stuff that you knew in medical school, and you're like, what is happening to my brain? Then you start residency and you're so focused on like learning just medicine and how medicine works. learning about the EMR system, learning about where things are, learning about protocols, learning about all these different things, while on top of learning how to take care of patients. There's so much going on that you will feel like, what did I even learn in med school? But just be patient with yourself. Things will start coming back to you, especially when you start getting into the rhythm of things and have a little bit more time to think on your own. You would realize that there are things that you learned in med school, and then you'll realize that there are things you didn't learn in med school, but it's okay. You do know the foundation. Just trust in yourself and be patient. Another thing I want to bring up is finances. Finances are very important. This is the time that we're finally getting paid compared to medical school. However, we're not getting paid a luxurious attending salary, and also especially for the amount of hours that we work. And then student loans will be knocking at your door within that after that 6 months. So make sure that you are getting places, like getting an apartment that you can afford, and making wise choices financially for yourself. It feels so different when you finally do get that paycheck. Like there's the urge to just buy everything that you can, but really they say that you should still act as if like you almost have like no pay, and try to save as much as you can and just start paying off those student loans, but really spend wisely and be tight on your money. So those are the things that I wish I knew before starting residency. Honestly, residency is still so much better than medical school, for the mere reason that you are finally doing what you came to medical school to do. You are working, you're getting a salary, and you have a little bit more freedom to like live a more adult life compared to what you were doing in med school. So those are my tips. If this was helpful in any way and you enjoyed this, make sure to press that like button. If you have any questions or comments, make sure you leave a comment. Subscribe to my channel if you want to know when my latest videos are coming out, and check me out on Instagram if you want to get to know me a little bit better. My IG handle is _MD. I'll see you guys on my next video. Bye.